Peace FM 104.3. Woodmintake.
Hello, good morning, Prof.
Hey, good morning, Kwame.
Yes, sir. How are we, sir?
Fine, thank you. Glad to be on your program.
Thank you. Glad that we have you. Give us a little education, Prof. Yesterday, we were told by the health minister that 2.5 million cedis has been allocated for our preparedness. First of all, let's start from there. How prepared are we?
This is a very interesting question that everybody wants to know about.
Yes.
When the news broke out that this new virus had emerged in China, the Ghana Health Service National Technical Coordinating Committee met, discussed the issue, identified the priority activities that needed to be put in motion, and we started the process.
We started the process. Educate us a bit. What exactly have we done so far? And is 2.5 million cedis adequate?
Well, the 2.5 million cedis is an emergency release of funds from the presidency to support the preparedness. Now, because this novel coronavirus is a respiratory virus, we already have a system in place that monitors people who are sick with respiratory illness, influenza-like illness.
Yes.
So an alert has gone out to all the hospitals that form the early warning system for respiratory disease. Secondly, the airport, because the major source is China, the Port Health has put a system in place to pick up people who have traveled from China who were showing signs of fever and respiratory illness. There is a form that they fill, and if they fall into the category of suspected respiratory illness, they will be advised to remain in isolation, and samples will be taken and tested for the coronavirus, and then they will be managed appropriately.
Do we have the means to manage this?
Well, depends on the scale that it will happen. So initially, 2 facilities have been identified where such patients will be managed, and resources are being mobilized to support the testing for the novel coronavirus, which we have established at Noguchi.
So Noguchi is well equipped to take care of this?
We do have sufficient resources for now, and efforts are being made to improve our capacity for numbers increasing along the line.
You mentioned, Prof, that 2.5 million cedis is emergency funds released. Based on your experience, is it adequate for now?
I think that it will depend on the scale of the response.
Okay.
You know that even in China, the numbers are increasing rapidly every day.
Yes.
But in the other countries, I think 23 of them, last count, the number of cases have been very few. I think the maximum was 15 or 20 in Thailand. So it's a case-by-case scenario. But we know that as this virus spreads, there will be more cases. But we should be reassured that in Ghana, we are in a tropical situation, whereas in China and the Western Hemisphere, they are in a winter situation. And respiratory disease in winter for people with hypertension, diabetes, and etc. is a public health threat, because those people often succumb to severe respiratory illness. Every year, over 50,000 people die from flu during the winter.
I see. Prof, when there are such outbreaks, sometimes ignorance leads to sensationalism. For those of us who do not understand the dynamics of this entire thing and are only reading and hearing from the news, what should we look out for? Flu symptoms, fever, what should we look out for?
You hit the nail on the head. It's a respiratory virus. The worry is that this is a new strain of the coronavirus that has come out.
A new strain?
Yes. So let me remind you that there is another strain of the coronavirus that is circulating in Saudi Arabia that is transmitted from camels to man.
From camels?
That virus
wow.
is not yet transmissible amongst men or humans. So the Ghana Health Service Ministry of Health has had a program in place with the Hajj Board. For the past couple of years, we've been screening returning Hajj pilgrims for the MERS coronavirus.
Wow. So
we know that the coronavirus is commonly associated with mild conditions in humans. When you have a runny nose, when you have a cold, when you have influenza-like symptoms, as you said, sometimes it could be a coronavirus. We've done studies in Ghana where about 2% of the people who have flu-like symptoms have a coronavirus. So it's not anything new, but because this is a new coronavirus and it's been associated with, severe illness in some aged people and people with other existing illness, that's why it's of significant concern and efforts are being made to try and contain it at the source and stop it from spreading to other countries. But sooner rather than later, a vaccine will be developed. We will know exactly what combination of treatment. We'll probably have a new antiviral that will be effective, just like we have about 4 antivirals for influenza. So it is a bit worrying now because it is new and it seems to be spreading. But modern science and medical science are really moving rapidly. Remember, this virus was identified very quickly within a couple of weeks. We've developed a diagnostic test to be able to detect it. So things are in motion.
Prof, I mentioned earlier ignorance and sensationalism. So if I have a common cold, a flu, fever, should I be afraid? Should I be cautious? Should I be relaxed? What should one do?
Okay. Listen, you get a fever when you have malaria-like symptoms. When it becomes worse, you go to a hospital. So the same thing with influenza-like symptoms. When you have a bad cold, you have a sore throat, then you have all this muscle pain, you can't do anything. It kind of pushes you to go to the hospital. So when you get to the hospital, then differential diagnosis is done. The first thing is to test for malaria because malaria is the most common, pathogen that causes these conditions. Rule out malaria. We do influenza, testing. We want to avoid it becoming a lower respiratory infection, which is the pneumonia. And that's the bad one because then when the fluid builds up in your lungs, you have all these secondary conditions, then, that brings you down and it's very, very serious. So when people get sick and they start feeling bad, they should go to hospital. The clinicians know best how to manage what they will be able to diagnose.
I see. Prof, finally, the Chinese New Year has come to an end, and there's an expected influx of Chinese people into Ghana, into other countries as well. For those of us here, what would you advise we do?
This is why I think the emergency release of funds from government is very important. They already have contingency plans in place, not just the airport, but at various ground crossing points, where the port health staff, together with the other agencies, monitor people who are coming in. There's already a system in place that picks up temperature screening, and of course, if you are ill when you arrive on a flight, port health are supposed to pull you aside and help you, help manage your condition. So this has been ramped up. And I think although there is some, worry that the numbers of people returning will increase, This is the same thing across all the African countries. And as I said, so far, I think it's only Cote d'Ivoire where we've had reports of a suspected case which was negative. So dealing with the issue of Ghanaian students returning and other groups, I think the monitoring system and the funds that the government is releasing will enable the agencies, to step up their game and monitor and manage, people who have signs of illness or who, because they have recently been in China, will pose some risk. Note that the main province, the city where coronavirus is spreading, has been shut down, and no travel in or out is allowed. So that is a reassuring step that the Chinese have taken. And I think stigma and discrimination will make things worse. And so we should just follow good personal hygiene. And if you feel sick, you go to a health facility.
So, Prof, apart from Cote d'Ivoire, we don't have any other reports?
I did read something about a case in South Africa, but so far, the latest report I looked at yesterday, no African country had found any confirmed case. So Africa is, clear so far. And as I told you, we're in a tropical environment, so that's not surprising.
There's an advantage to heat after all, huh?
yes. But we know that the coronaviruses are everywhere. So and we do get flu all year round in Ghana from our, influenza sentinel surveillance system. So we don't usually have severe flu resulting in death. So that is another plus for our system. But we know that our health system, needs to be strengthened, and this is an opportunity to improve our system. So the release of the funds and probably additional money from the presidency and the government is really timely and should be supported.
I appreciate your time, Prof. Thank you so very much this morning.
Anytime, Kwame.
Yes, all the best. Sir. All the best. Professor William Ampof is head of virology at the Noguchi Memorial Institute for Medical Research, bringing the time to 21 minutes.
This FM 104.3. Good to meet you.